didn't realize until a few minutes ago how very powerful last year's conference was. It was wonderful already. It was refreshing. And then, as I was wondering why Paul asked me to do infant mortality, I realized I'm in education. I don't really have a lot to say about infant mortality. But last year, what I learned from the conference put me into a work group where I'm working with Rod Coker, who you met earlier, to bring a statewide charter school career academy to Georgia for reducing workforce shortages in the state, which is something that came out of several discussions held after the conference last year, as well as the conference. And so I think the follow-up this year can also be invaluable to everyone. So another plug for staying until the very end. So I come from education, healthcare, and again, I think I sent Paul at least a couple of emails saying, are you sure I'm the one you want for infant mortality? Because I don't know a lot about it, but I reminded myself that I've got a master's of science. So I've taken the physics classes and the statistics classes and the quantitative analysis classes, and I read medical journals, and I can understand science and data. So I can look at what you wanted me to speak on, and I can analyze that, and I can help others analyze that too. And not only that, but I recall that I lived for 25 years in the neighborhood surrounding Emory, and I worked at Emory for 7 years on the neurology floor. And so all of my friends were researchers and scientists at the CDC, and we would meet for supper after work hours, and they would tell me their secrets. And from things such as 20 years ago, don't use antibacterial soap and don't use hand sanitizers, because 20 years from now, we're going to have super bugs that we can't treat and do anything about. And so trying to find non-antibacterial soap for my household and getting the evil looks when I wasn't contributing the hand sanitizers to the classroom projects 20 years later, and we're all being told stop with the antibacterial soaps because they're not healthy for us. And then my neighbor was a cancer researcher at the CDC doing lots of work, and we're talking one day, and I said, how are you coming on that cure for cancer? And he said, cancer is a multi-billion-dollar industry. We're not looking at a cure for cancer, we're looking at a treatment for a chronic illness. And that's how we view cancer now. And so that says a lot to us in terms of where are we going with cancer and our research for cancer. And yes, it has become more of a manageable chronic illness, and maybe the next phase is finding a cure for cancer. So that brings me to the infant mortality and reducing infant mortality and maternal mortality. And the first, there's really two different subjects. And so the first thing I do is Google infant mortality rates, reducing infant mortality rates. And what I find is that the U.S. is 41st in the world in developed countries for infant mortality deaths, or infant mortality, and which initially sounds like a really, really bad place to be. And so I'm thinking, well, that doesn't make any sense at all, because we have great health care and prenatal care, and I've been a mother. I know the rigors they put you through when you go through your prenatal care. So how are we so very low? And so then I do a little bit more digging, and you have to get off the first page of your Google results. And you have to get away from the CDC, because I know the CDC can say, publish some things, and then other things may actually be the case. And sometimes when we're looking at data, the charts may not be as they appear, because as many of us here in the technology crowd, garbage in, garbage out, and data can say a lot of what we want it to say, or what we feel like it should say, for lots of different reasons. So this was the first chart I pulled up, and I redrew it here from memory. Back in 1900, our infant mortality rates were about 150 deaths per 1,000 births. And so it varied and varied, and probably dipped down during the Depression or Hungary. And then in that 1940, we had a huge drop from 150 down to about 63. We cut it in half from 1940 to 1950. And I'm thinking, don't really know what was going on in the U.S. at that time, except our soldiers were coming home from war. We had a lot more home from war, had a lot more babies being born. But I don't know if their nutritional status was really that different, or our medical care was really that different. And I didn't really probe into it. I just thought that's an interesting thing to note. And then we go along, and it's about the same until 1990, and we see another huge drop by half from, let's see, 32 to about 4.0 births by 1,000 will result in infant mortality. And then in 1990 to 2015, we've seen an increase in infant deaths per 1,000, up to where we are currently at 6.4. So of the developed countries in the world, we're ranked 41st, and our infant mortality is really only about 6.4 deaths per 1,000 births, which I think is pretty good considering we came from 32 here and 63 there. And but we have this increase that we've noticed over the past few years since about 2008. We see that our numbers are going up, and what explains that? So another thing that I noted, another chart that I found, was from the World Health Organization that showed that from 1990 to 2015, over 25 years, one generation, we've dropped infant mortality rates from 8.3 million to 4.5 million globally, and so we brought them down by half, and that's really pretty fabulous. And so the goal for this section was to bring them all the way down to zero, I think, globally, an impossible goal, and it looks like we're making a lot of good progress in that way. But then I'm thinking, what is an infant mortality? What is an infant? Because I think of an infant, I'm not exactly sure what those age ranges are. So what would you consider to be an infant?
Under 12 months?
Under 12 months.
Under 12 months?
Birth to 12 months? Before birth? Yeah. And so it's good. I like the blank stares because that's what many people have, because the definition for infant is different depending on what country you're looking at. And so when we look at the definition of an infant, some countries view them as any time a fetus is viable to birth can be considered an infant, birth to 1 year, or viable to 5 years of age. And those will all be included in the infant mortality rates. And so when we considered this drop here, and then this increase, we can suddenly say, if everyone's using a different definition, then how do we possibly get an accurate graph? And some countries are simply using, let's see, I had to make notes because it's not my area of expertise. We're using sort of look-back samples where we are reviewing a family's history, and we visit the family every 5 years. And we say, did you have any babies die? And the family tells us yes or no. And so that's one way of gathering data, and that happens a fair amount in our developing countries. And in our developing countries, we have an infant mortality rate of 55 per 1,000, and in the developed countries, it's 10 per 1,000. And so America's still, certainly doing well as a developed country, and we'll get into the difference between developing countries and developed countries. But looking at how we're sampling and how we're defining what an infant is. A lot of the countries, America included, uses this definition here of anything, a fetus that's viable up through 5 years of age is considered an infant mortality when they die within that time frame. A lot of countries don't consider a viable fetus. A lot of countries, if a baby is born and has low birth weight and dies a few days later, they're not included in the data, in the sampling. And so definition is oftentimes, when we look at charts and graphs, oftentimes the change in definition is responsible for these huge drops or the huge increases. And sometimes it's political, other times it's just because we've updated our systems. It can be a lot of different reasons. And that's why I said, Paul, I'm okay with going ahead with speaking on infant mortality, and he said, you want to not do it? And I said, I think when we look at data, it's really applicable to almost everything we do, both at work and at home. So we have developing countries, and the WHO looks at the African region, primarily looking at bringing these numbers out of the African region, and then developed countries, and these numbers are out of the European region. And just off the top of your heads, because we've got a lot of experience we're fully grown human beings. What would be a way to bring these numbers closer to these numbers for developing countries? What do we typically think of for improving the life and viability of an infant in a developing country? If we want to improve it, what are we going to do?
Prenatal
Education, nutrition, healthcare. Let's see, education.
Get rid of the wars.
Do what?
Get rid of wars.
Get rid of wars.
There's a lot of warfare against it.
Yeah, especially if you're counting all the way up to age 5, then absolutely. And then in developed countries, what would be a way to bring this number down to 0? What would we do there? How good can we get our nutrition? How much education can we give our mothers? Are those the things that are really going to get us to 0 infant mortality? Or do we have to look at something else?
Yeah.
And so, let's see, you guys are right on the money with what I found in my research, that nutrition plays a big role in developing countries. Access to health care. Location of birth, is it at home, is it in a hospital? Is it with a physician, is it with a midwife? Makes a difference. And then our data collection, how are we collecting retrospectively, or are we doing it in a hospital at the time of the death? So, and developed countries. This was very interesting. It took a little bit more digging because it's not something that you would expect. And I didn't spend a huge amount of time on this, but just a sampling of what I found in developed countries, the difference between Luxembourg, for example, and America. And Luxembourg is ranked #1 in having the lowest infant mortality. And so what do they do? And what do we find here in America as well? We found that maternal marital status is a huge predictor for infant mortality, which is interesting. And then also in developing countries, we have to include this educational level as well. Tennessee happens to have the highest number in the country of infant mortality rates, and it's primarily mothers who are unwed and low education levels. Nutrition, in some countries that ban GMOs and non-GMOs, they have higher levels of I guess, healthy babies born, less infant mortality. Is that the reason? I don't know. I didn't really look into it. Just kind of interesting. Abortion. This was a topic that came up a lot, whether it's legal or illegal, common or uncommon. And so in countries where it is legal and common, the infant mortality rate tends to be lower because we're not including in those counts any child that is not born yet. So a stillbirth would not be included, and an abortion would not be included. In countries where it is illegal and uncommon, they will oftentimes include the aborted babies or fetuses or things with the numbers for infant death and mortality. And so the next area, view of women in areas of the world where there's Sharia law. And in China, we don't get numbers. So basically, they could have 0 infant mortality. We don't know because they're not reporting on those things. And we all can form your own opinions about why that is. But our data is lacking those numbers. And then vaccines, some reports, some results, and research showing that vaccines during pregnancy, which typically is voided, result in low birth weight and sudden infant death syndrome. And so in countries where they don't have as many vaccines as other countries, they tend to have lower infant mortality rates. And then for this country, one of the possible reasons why we've got this creeping back up is that 1 in 4 women are on SSRIs for depression or anxiety, and they're encouraged to go off those medications a year before they want to get pregnant. But while they're on medications, if they're pregnant, sometimes some people can believe that it causes low birth weight in children, and so could contribute to infant mortality.
What does the SSRI stand for?
It's your Zoloft, your Prozac, your antidepressants, and anxiety meds. And so multiple different factors, and are we willing to take steps that might be necessary to address some of these issues? Some of our cultural issues to reduce infant mortality down to 0? Are we willing to really have these difficult discussions? Because it's not easy to write these things on a flip chart and present them to strangers. And then the other thing that pops out is that this, and some of the articles that I read, looking at the increase again in infant mortality in the United States, this happened right around 2008, that began creeping back up again, right around the time that we really began looking at our healthcare system, and we needed to have evidence to show that the Western American healthcare system might not be as good as we thought it was. And so, are these numbers accurate, or are they biased in a way toward or against the healthcare system that we had back in 1998 or 2008? So, when you're looking at data, looking at it with a critical eye, and garbage in, garbage out, realizing that the data often can show what the examiners want it to show, and that a real life experience has to take into account what we're seeing, and how we oftentimes feel uneasy when we see something that just doesn't sound right. Because when we say the U.S. is 41st in the world in infant mortality rates, it makes us sound like we need to get on the ball and do something about that. But actually, we may have brought infant mortality rates down to the level of as good as they can get, because the only way you can reduce it to 0 would be to say possibly that women shouldn't be pregnant, and women shouldn't carry children. And it sounds preposterous, but when we look at a world of technology, we have the ability to grow children and babies in test tubes outside of a woman's body. And so perhaps that, if we're that committed to our goal, perhaps that would be the end result. So that was me. No tango dancing.
No tango dancing.